This is Pet Life Radio. Let's talk pets.
And we're ready. We're live here on Pet Life Radio and Instagram Live. You're here live with Dr. Jeff Werber, your host for the next 30 minutes here on Pet Life Radio's Ask the Best with Dr. Jeff. And here for you, here for your pets. Let's try to discuss anything you want to discuss. In fact, I could use some good questions today because there's not a lot of good stuff happening in the veterinary world on the news sites. So let's count on you to, we'll get some really good questions going. And of course, if there were any questions I didn't get to last week, please re-ask them, because now I'm going to go ahead and just wave. I'm waving. First of all, this was the first Saturday in about 4 weeks, 3 weeks that didn't rain, and that's really good. My new little grandson is doing great, for those of you who even care, but his name is Sasha, and he's really, really cute. I mean, it's amazing how little they are, but he's adorable. I don't know if I got a chance to tell you, but chemotherapy and veterinary medicine, that's a great thing to talk about, chemotherapy. In fact, I was just going to talk about a cancer case that I had. It was that very ugly 6-pound tumor. That one came back benign, which was amazing because I mean, there's no way I expected that. It was really, really ugly. So anyway, let's talk about chemo. As we know, cancer is a bummer, and it's very, very common in pets, as it is with people, unfortunately. So many different ways to treat. So obviously, depending on the type of cancer, the first thing we try to do is, if possible, if it's a surgical kind of removal, is remove the cancer. For example, that big splenectomy I just did, that is a big problem in especially larger breed dogs. They get splenic tumors. Unfortunately, they say about 60 to 70% of them are splenic hemangiosarcoma, which is not a good prognosis. Even though if we take the spleen out, and we do, we always know that the cancer cells have already invaded the blood. And at some point, we are going to have problems with what we call metastases, either to the liver or the lungs. Very, very common and very sad, because even with successful surgery, the long-term prognosis is pretty poor. This particular case that I just did actually came back as one of the benign versions, which is, as I said, 30 to 40% of them are benign. And we got really lucky because this one didn't look like a benign cancer. Now, what about other ways to treat cancer? So if you have a cancer that you can remove or debulk, meaning we can shrink it, but we can't remove it all, then we typically follow with chemotherapy and or radiation therapy, again, depending on the type of cancer and where it is. Now, interestingly, there's a new trend, and that is that do the radiation first, shrink the tumor, make it more manageable to be removed, and then you remove it surgically, and maybe you can get all of it. So that is something you discuss with the veterinary oncologist. But anyway, that's a theory. Then there's chemo. And chemotherapy is good for some generalized cancers where they're not good for radiation. And it depends on location and also the nature of the cancer. Some cancers are more receptive to radiation therapy and others aren't. And those that aren't surgical and don't do radiation, then hopefully we can do something with chemo. Now, I have had a case, been working on it. We just did its 5th treatment. This dog has responded beautifully to the cancer. And it's crazy because first of all, it's a much older dog. And according to the pet mom who was in with the dog on Friday, we gave the last treatment Friday, the dog is like a new dog. And unfortunately, with this type of cancer, we can only max at 5 of this particular, it's called adriamycin, a very strong anti-cancer agent. And you want to max out at 5 treatments and every time you do chemotherapy or even radiation, you always want to check again with some blood testing to make sure that we're not knocking out too many of the good cells. A lot of times we're destroying red cells. We can make them too anemic or drop the white cells too low. So we have to be very careful. It's like a dance. So we have these protocols. And I mean, sometimes the difference between some of the protocols might be a month or 2 as far as survival rate. And then you have to say to yourself, but some of these, for example, treating lymphoma, the newer protocol is called the Wisconsin protocol. Very, very detailed, very expensive. It's about 25 weeks long, and it is very effective. Now, a lot of times, depending on the case, that's why we really, when we treat cancer, we want to individualize as much as possible. And there's an old protocol, one of the older ones that was around when I graduated. This is 40 years ago, called the COP or CHOP or COP protocol. And a lot of times I'll elect for that one for depending on personal reasons, financial reasons. And I got to tell you, it still works really, really well. So you have to weigh all these things. If it's a simple cancer, I love doing the cancer surgeries. So I'll always debulk. Then I have to send them for radiation or chemo. It depends on the chemo protocol they want to do. I do a lot of the chemos, and others I'll send to the oncologist. So, the good news is that there are certain cancers, as in people, that are actually curable. Those are the ones that you can remove surgically, and they turn out not to be as aggressive. Different stages, every tumor is staged. Stage 1, 2, 3, 1 to 4, depending on the cancer. And you make your decisions that way. The good news is, as in people, most of cancers we see in older people, I've treated. I remember my first case when I was on my oncology rotation in vet school was a 7-month-old magnificent golden retriever that had a fibrosarcoma, which is a very aggressive cancer. And ultimately, this poor puppy had to be put to sleep. And that was so heartbreaking. And that's, when I realized as I'm going to be going to Children's Hospital LA in a couple of weeks to speaking on dog bites, that I walk in there and it's really depressing to see how many young children have, cancers. And you realize when you're a parent and now a grandparent, how lucky we are for those of us that have not had to deal with that. So the chemo, back to the original question, it really depends. It's effective. It could be expensive. But the good news is, and this, I guess, is a philosophical issue, because our pets, and usually the ones that get cancer are already older, aren't going to survive as long as we would love them to, that the philosophy behind treating pets with cancer is a little bit different. The animals at the doses that we use and the protocols that we use, we don't really knock them out like where they have to be hospitalized for weeks and they're losing their hair and the severe nausea. I mean, yeah, there are going to be some side effects, but not as aggressive because we don't treat it as aggressively because we know to do that to them, we're not going to get another 10 years is what we hope. We're going to get maybe 10 months, a year and a half. So we don't treat as aggressively. So the dogs going through chemo tend to do really well. So if your dog, heaven forbid, has cancer and you're talking to your veterinarian, don't fear that, oh my God, my mom had cancer and she was a wreck. We don't do that to the dogs and the cats. We treat them. They tolerate the meds very well. And we know that the goal is to either slow down, shrink the cancer, slow it down, make it more livable for them. But ultimately, they're going to go. Now, when I did my major surgery on my lab many years ago, he had a severe grade 3 mast cell tumor, very aggressive. He was 15 years old. I did surgery on him at 15, and he did amazingly well. Put him on a chemotherapy called Palladia that worked so well against this cancer that he lived a year and a half. I finally put him to sleep at 16 and a half, and not because of the cancer. It was just amazing. So, you get lucky too. I got really lucky with that one. All right. Next up, the good question. I did test my cat, result mycoplasma positive medication. So usually with mycoplasma, doxycycline seems to work well with mycoplasma. There's a number of, some of the penicillins can also work well with mycoplasma. So usually if they identify an organism like that, they often will do a culture. And that way you can tell what antibiotic would be the best. But we've had a lot of luck with treating some of these with doxy and some of the penicillins. So anyway, that is something that you can talk to your veterinarian about, but it works pretty well. An arthritis question. My Jack Russell had her 60th birthday. Wow, love it. And her arthritis in the back legs have recently started a bit. So Dasaquin is good. I'm a fan. But what I would do is there are some other things. There is a non-steroidal anti-inflammatories or steroidal anti-inflammatories could help. But there's a new injection. It's kind of like a vaccine. It's an immunotherapy called Librela. It's by Zoetis, Librela. You got to speak to your veterinarian about it. It is for osteoarthritis pain. It actually blocks the pain receptors, and it is very effective. I've had patients come in that were like severely debilitated, couldn't move because of the arthritis, the pain, whatever. And that Librela brings it back to life. So it's a little expensive. It's a monthly injection, but I got to tell you, well worth it. So my treatment plan now is either like a glucosamine chondroitin type medication. I still, for really bad cases, like the Adequan. The Adequan is an injection. It's a polysulfated glycosaminoglycans, and it really, really is effective. It helps a lot. So for me, it's the Adequan injections. It is the Librela, and then some sort of anti-inflammatory as well. If I can, I would prefer the non-steroidal anti-inflammatories. If the pet is older or has liver or kidney issues, then we'll go with Galliprant. Otherwise, the Carprofen, Vetprofen works really well. That's the good old-fashioned Rimadyl. Metacam, Meloxicam works really well. So there are some others that you can use, speak to your veterinarian, of the non-steroidal anti-inflammatories. All right. Natural remedies. Look, try CBD. Actually, look, the glucosamines, the Dasaquins, the Adequan, it's a polysulfated glycosaminoglycans. It is sort of on the natural side. You can try it. And anything that typically is going to be good for either pain or for actually inflammation on the natural side, there's no negative, no downside to working that into the combination of medications as well. So I would go for it. How can I put more weight on my dog? Very athletic, high energy Doberman. Okay, so this is a problem that we see very often, unfortunately, and that is a dog who needs to gain weight. With us, typically in veterinary medicine, it's the opposite. When you think about the number one nutritional disease affecting our pets, it's obesity. So to have a dog that needs to gain weight, I love it. So if the dogs will eat more, then let them eat a little bit more. If you have to add more calories, more carbs, that might be helpful. I think about these dogs, for example, the Belgian Malinois, and these dogs are so active. There's a thing on TikTok someone sent me with a Malinois literally going through an obstacle course, kind of like they do it a Ninja Warrior, American Ninja Warrior, and he ends it with jumping on a roof and putting his paws up on the big. It's amazing. They are absolutely unbelievable dogs. So anyway, they are very thin. They're very wiry, and that's just part of who they are. They have a very high metabolism. You don't want to get them fat. So Dobermans also are very athletic. They're meant to be very lean, very slim. So if the ribs aren't showing, then let them be lean. If the ribs are showing, then I would say try to fatten them up a little bit. Just add more calories. Get food with a higher caloric intake. If he'll eat more of what he's eating, just give him more. Give him an extra meal a day. If he's not, or he's like walking away from a full food bowl where he's stuffed already, then you need to find a food that has sort of a higher calorie content, poorer volume of food. So it's great that he's doing well. Okay, insect protection. So yes, that's a good one. Eggs or ground eggshells go to a dog. Just a little, I've heard that the calcium is good. I have not used it for my dogs. They do like to crunch. They do have sharp edges. I would faster ground them, like a coffee grinder, almost like a powder consistency, and then sprinkle it on the food. That would make it, safer for me as far as the sharp edges going down into an esophagus and potentially cutting the esophagus. If I feed him too much, he gets poop. So then you're looking at, let's go back to the calorie load, then look for a more calorie dense food where there's more calories in the volume of food, and that should help. He eats raw. Maybe try to look for some healthier kibble or look at your raw diets, find something that actually has more calories per volume, whether it's per cup or per ounce, however, on the ingredients, look for something with a high caloric load. If he's happy and he's energetic, and everything is fine. There are a lot of people out there that are going to be very jealous of him. So just let him be thin. That's okay. I'll tell you what, it's 17 after the hour. We have to go for our quick break here, both on Pet Life Radio and Instagram. Stick around on Instagram. I will talk during my break at Pet Life Radio, and we'll come back after these very short messages.
Take a bite out of your competition. Advertise your business with an ad in Pet Life Radio podcasts and radio shows. There is no other pet-related media that is as large and reaches more pet parents and pet lovers than Pet Life Radio. With over 7 million monthly listeners, Pet Life Radio podcasts are available on all major podcast platforms, and our live radio stream goes out to over 250 million subscribers on iHeartRadio, Odyssey, TuneIn, and other streaming apps. For more information on how you can advertise on the #1 pet podcast and radio network, visit PetLifeRadio.com/advertise today.
Let's talk pets.
Let's talk pets
On Pet Life Radio.
Pet Life Radio.
PetLifeRadio.com.
And we're back. We're back live here at Pet Life Radio and Instagram. So there were two things I wanted to go through on before we got. One is an insect protection spring. Very good. So yes, there are mosquitoes. When there are mosquitoes, there is a potential for heartworm disease. So if you are in the South, well, all year round in the South and the Gulf states, if you are in the Northeast, we're going to start seeing the humidity increases during spring and summer. We're going to see mosquitoes, and we're even seeing some mosquitoes out here in the West. There is a breed of mosquito that seems to be thriving in our drier climate. So we are recommending heartworm prevention, certainly spring and summer, in many parts of the country, all year round. Many of the good flea and tick products that I like and recommend, NexGard, Simparica, Credelio, and Bravecto, they now have three of them, the 3 monthly ones, which are the Credelio has Credelio Plus, NexGard has NexGard Plus, and Simparica has Simparica Trio. Flea, tick, and heartworm all together. So that would be a strong recommendation. When it comes to heartworm disease, you want to make sure, have your veterinarian check out your pet before season, before you start, to make sure they are heartworm negative to start, and then go from there. Another reason that you want to be a bit aggressive with that is that many of the companies, if not all, will typically guarantee their product. And if you can prove that your pet started with a heartworm negative, that was given the treatments religiously every 30 days, and then still comes down with heartworm, they will contribute to the heartworm treatment. Heartworm treatment can be very expensive. It's also potentially dangerous. You're giving your pet an arsenical compound to kill the adult heartworm. So it's not like a breezy walk in the park. It is something that is potentially dangerous. So you want to be very, very careful. Again, talk to your veterinarians, but I would 100% recommend prevention. Now, anything topical, there are some topical sprays. I know that many of us that have gone to like the Amazon or jungle climates, or where we know there are going to be a lot of mosquitoes, there are some sprays that you can spray on. Again, that have DEET in them. Check with the veterinarian. Some of them will say safe for pets, and some of them will not. So I want to be very careful. Be very careful with any insecticides and cats, because many insecticides, even the ones that are safe for dogs, can be deadly to cats. So again, check labels, talk to your veterinarian. Don't always trust the labels, by the way, because there was a product out there. I don't want to mention the brand name or the company that was making it, but it has been implicated in the deaths of hundreds of cats. So it was not as safe as they thought it was. Clearly, it was terrible. This company is really not well liked in the veterinary world. Let's put it that way. So anyway, you want to be really careful. There was a question here that I wanted to cover about a boxer. So this is, I just lost my third boxer to cancer. I love the breed, but lost to cancer is heartbreaking. Antibiotics advances vet medicine. So there's no good news. The only thing I can tell you is, unfortunately, for the golden retriever, who just took over for the boxer as the number one cancer dog breed out there. Boxers were number one for a long time. We're seeing a lot of cancers in goldens as well. Obviously, it's a problem. It has a lot to do with breeding. There's definitely a genetic component to predisposition to cancers. And once they get in the line, it gets in the line. So as these dogs that become very popular, a lot of the problems seem to increase dramatically, exponentially. Look at the French Bulldog. Because they became so popular, they are basically, the breeding practices are more geared to the money making, not to the health of their breed. Very sad state. So what's happening is these dogs are unfortunately breeding in a lot of the problems that they have, which is why, we've always had Frenchies with their problems, but now with food allergies and skin infections, obviously the breathing issues, we're seeing a lot more of their back issues, their spinal issues, their disc disease. We're seeing a lot more in these Frenchies now than I did, say, 20 years ago. And obviously we're seeing more because there are more, but even still, it seems like percentage, how common these issues are, is becoming more common. Boxers have always been known to be the number one cancer dog. And there's no prevention. Now, there are some tests out there, and you want to check with your veterinarian. There are some tests out there that claim to be able to predict the cancers in your dogs. And their blood test, one is, I think is called Oncocanine. There's another one out there. I'll get the names. I'll print them out. But there are two tests. I think one is more respected, I guess, by the veterinary community, but it's expensive. It's an expensive test, but it can sort of be, it's sort of like the SDMA test that a lot of the labs use to predict the kidney disease issue in dogs. This is a predictor of cancer based on algorithms, based on a lot of things that can evaluate, look for certain, I guess it's genes or gene markers in a blood test that can predict the likelihood of your pet developing cancer. It might even could identify there was some cancer in there. Now your job is just to find it. I'm using a device. I think I talked about it last week out of Israel. It's the HT Vista, and it is a device. It's a probe that I can actually probe a skin or subcutaneous cancer. And I can't tell you whether it's 100% cancer, but I can tell you the mass, it does not behave like a benign mass or a benign tissue. So that's why in the scan, we always include normal skin, and it compares to an algorithm the response of the tumor tissue or the mass tissue to the normal tissue. And it can say, yes, this is still, even though it's a mass, like a lipoma, it's still behaving like a benign mass, or high predictive index that it is not benign. It doesn't 100% say it is cancer, but it's not benign. We use this test now to determine the urgency of when should we remove this mass. Should we wait until the next dentistry? It might be 6 months. Or if it is a high predictive index that it is not behaving like a benign mass or benign skin, then we're going to take it sooner. So it's really cool. So check with your vet about the tests that are out there for predicting or identifying cancer genes through cancer gene markers. And then you can obviously then go from there. But if you already have the dog, all it's going to do is put you on lookout. It's not going to prevent cancer yet. Now, where we go to cancer prevention, now we're talking a whole different new science. And from discussing this a couple of years ago, actually, with one of my mentors who is double boarded in internal medicine and veterinary oncology, also has a PhD in comparative oncology, which she got from Stanford. We're not talking a dummy here. And she said that the advances in cancer are probably going to become through immunotherapy, where we, through however means possible, and we've do this being done now on some like mast cell tumors and some other cancers, like it was one other cancer that we see, like, again, it's bad in oral. It's like melanoma. And so melanoma in dogs is, in the skin is not as aggressive as it is in people, but in the mouth and the nail beds, it's very. There is a melanoma vaccine that, again, it's training the body's immune system to attack its own cancer cells. And that seems to be where the future of cancer therapy is going to come. Figuring out from a gene standpoint how to stop the genes from producing these cancer cells, and also from the body to be able to attack its own cancer cells through immune stimulation. So just the chemotherapy to destroy, as we know, it can work a while, but it ultimately is not going to be a cure. So to find a cure, we need to train the body to do its own cancer attacking, and or to stop the actual genes themselves, to modify the genes away from producing these cancer cells. So it's going to happen. I'm sure you've heard that they're predicting by, I don't know, next 50 or some odd years, cancer is going to be an unknown entity. Would that be great? All right. So I think I got everybody. And if you have any more, please ask away. Love the questions. So I'd like to talk to your dog. I said, Mansach Diva, because if I could figure out a way that I can do that, I can eat what I want and stay lean, I'd love it. Okay. I think we're good. Okay, everybody. So, by the way, just because the show's over, it doesn't mean my desire to answer your questions is over. You can reach me anytime here on Instagram or on Pet Life Radio. All the questions get sent to me. I will happily take care of them. Otherwise, I'll be here next week, same bat time, same bat channel, here on Instagram Live, here on Pet Life Radio, to talk dogs, talk cats, talk pets, anything you want to know. And if I don't have an answer, I will get you the answer. That's why there's a lot of things out there that I don't know. Fortunately, I'd like to say not too many. There's a lot. But I'm here to help when I can. All right. So have a wonderful week, and we'll see you next week. Bye.
Let's Talk Pets, every week on demand, only on PetLifeRadio.com.